All right, we are recording. So again, thanks for joining us this morning. Just some housekeeping stuff. If you are not on mute and not speaking, if you could go ahead and mute yourself, that would be great, just so we don't have any weird feedback noise. Also, if you have any questions, feel free to drop them in the chat box. We'll be sure to try and get to those towards the end of the webinar. But for the sake of time, I'm going to go ahead and pass it to Mackie King. Mackie King is a pharmacist based out of Wilmington, North Carolina, and is going to talk a little bit about what the North Carolina Association of Pharmacists has been working on recently around some legislation that's being introduced here in North Carolina. So Mackie, the floor is yours.
Thanks, Matt. I appreciate that. So I'm here just to kind of review the legislation that was recently submitted. So it was both in the House and the Senate here in North Carolina. And the legislation is aimed to accomplish a couple different things, some of it which will be of immediate importance to this group. There's about 10 different categories that the North Carolina Association of Pharmacists is trying to help pharmacists be able to provide services for our community, particularly in rural areas. So things such as providing naloxone to patients who may be prescribed opioids, which is the medication that could reverse an opioid overdose. Things like being able to prescribe tobacco cessation if you have patients who want to quit smoking, being able to test and then treat if patients are positive for flu with point of care testing. There's several states in the country where pharmacists can prescribe hormonal contraceptives, so trying to do things like that. Particularly what would be of interest to this group is there's also some wording in the legislation to be able to prescribe medications for post-exposure prophylaxis as well as pre-exposure prophylaxis. So they're still working through some of the details. Of course, it would be following CDC guidelines, but still working through some of the details about what testing would be involved and kind of the follow-up from there. But there is wording in the bill currently to allow pharmacists to be able to prescribe PEP and PrEP. We have a little bit of a challenge at the moment. North Carolina has something that is called a clinical pharmacist practitioner, and they are pharmacists who work under collaborative practice agreements. They typically work in health systems, and they work, as I said, under collaborative practice agreements. So for example, myself, so if I want to prescribe PEP or PrEP, I can add that into my agreement. And this wording was introduced to the legislation, which is kind of counter to the goals that the North Carolina Association of Pharmacists is trying to do. Additionally, it was introduced that pharmacists have to have their immunizing pharmacists, which basically just means that they have taken an extra course that allows them to immunize. One of the problems that we see with this is by limiting it to only pharmacists who are immunizing pharmacists or clinical pharmacist practitioners, we're not being able to really hit the areas that we need to be able to get to. And it's kind of arbitrary. I'm not sure what would make a pharmacist who is an immunizing pharmacist more capable to do some of the things that we talked about here than your everyday pharmacist who may not necessarily have that certification. So those are kind of some of the things that NCAP is going to be working on, is trying to see if we can remove that wording and expand this to all pharmacists within North Carolina. As I'm sure others will talk about here later, there are other pharmacists in other states that are already doing this and allow pharmacists to do this. So we're hoping to kind of move this forward and get North Carolina on board. Are there any questions, or is there anything I can try to clarify for anybody?
If so, feel free to go ahead and drop them in the chat. I'm also going to drop the link to the Senate bill, which the language for the Senate bill and the House bill are identical. So feel free to read over that if you want to see what the actual verbiage is, but I dropped that in the chat and I'll send it along later as well. So, but any questions for Mackie before we move on? I know he's got a patient that's going to be waiting in the waiting room probably.
I would say this is certainly a step in the right direction. Allowing pharmacists to be able to prescribe or to do this service, which we're already doing elsewhere, and it's a service that a lot of us would be able to provide for patients with our community. It's a need that's not being addressed necessarily always in other areas of healthcare. We're just hoping to remove those last two barriers to be able to expand it to all pharmacists versus those who may already be doing it.
Awesome. Well, I don't see any questions. If anybody does have any follow-up questions after the webinar, feel free to reach out to me and I'll get in touch with Mackie and try and get that answered for you. But we appreciate you, Mackie. Thanks for sharing that information with us. And I think, as Mackie said, it's a step in the right direction for North Carolina, but there are some barriers still. And if we're really trying to make PrEP and PEP more accessible for the folks who are most in need, we really need to remove those barriers as much as possible. So, yeah, thanks, Mackie. Awesome. So I am going to go ahead and pass it over to Alejandro Acosta from the Southern AIDS Coalition to introduce himself and the work that we're going to be doing with SAC over the next little bit. So Alejandro, the floor is yours.
Hi everyone, my name is Alejandro Acosta. I am the Director of Public Policy and Advocacy for the Southern AIDS Coalition. We have partnered up with NCAN to actually have this legislative effort happening. The Southern AIDS Coalition is an organization based in the South, and we aim to end HIV and STI transmissions by promoting accessible, high-quality systems of care for HIV and STI, including housing, treatment, prevention. And as you guys have heard from the pharmacist, Mackie, who just spoke, these are things that can make access easier. And so we are very, very proud to have partnered with NCAN because of the work that we're doing in North Carolina. I'm here for a little bit. I will be traveling a little later today, so I will be leaving around 9:30, but I really wanted to be here to listen to the great job that they're doing. And if you guys have any questions, or if you guys have any want to reach out, my email, I will put it in the chat, is alejandro@southernaidscoalition.org. Thank you.
Awesome. Great. Thanks so much, Alejandro. So I'm going to share my screen really quickly. Let me get there. And just do a quick overview of what has happened as far as some national advocacy and policy around this topic. Ariana Fisher, who is a master's student at Duke, worked with us, and we presented on this at a couple of different places, but let me see. But just wanted to kind of fly through some advocacy that's happened and some policy change across the country around this. So there are some serious issues when it comes to access to PrEP and PEP across the country, but especially here in the South. And I think just to highlight a couple of those things and why these policies have kind of moved forward, there are issues as far as getting access to PrEP through providers. So stigma from physicians and other healthcare providers, we see that a lot in the South. I know that I've spoken to a lot of folks here in North Carolina that's been a big barrier, as well as location to healthcare facilities. I'll show a slide here in a little bit about where folks are able to access PrEP in North Carolina, and there's some really large gaps of where there is absolutely no PrEP services near folks. Also with PEP, with the emergency use of PEP and the need for the 72-hour window to start that process, access is limited to just 4 nights and weekends. So, or excuse me, access is hard to come by for nights and weekends unless you go to an emergency department. And especially, I think, given the scope of COVID-19 and how that's impacted our communities and the burden that that's put on healthcare facilities. Getting a doctor's appointment can be really difficult. And if you're in an emergency situation and don't want to go to the emergency room and can't get a visit with your doctor, we see this as a really easy way for folks to have access to PEP. And also pre-authorization requirements for insurance approval have been a barrier. So the first place to really start this fight was in it was in New York. They allowed for pharmacists to prescribe PEP through PEP starter kits. It started in the New York Department of Health and Mental Hygiene. They did a survey to kind of push this forward. And in 2017, they passed a standing order in New York State that would allow pharmacists to prescribe an initial 7-day supply of PEP. And then from there, they would link to a healthcare provider for the HIV test in the remaining 21 days. So it's a very short window of things, but it's still a way to get folks initially on the 7-day regimen of PEP. So step in the right direction. Of course, that would be some barriers for folks who might not have access to healthcare, but step in the right direction. And then, so we started seeing some legislative policy change. The first that we saw was in California, and Craig is going to be talking about that in a couple minutes, but wanted to highlight some others that have happened since then. So Colorado in January of last year introduced House Bill 20-1061, and it included the ability for pharmacists to administer and interpret HIV tests, the ability for pharmacists to prescribe a 28-day supply of PEP, which is the full dosage, a pharmacist to be able to prescribe PrEP, and it also removed insurance pre-authorization requirements for both PrEP and PEP, which was a really big deal. So this is a quote from Senator Dominic Moreno that we've used several different times, and I think is a really good indication of the importance of this. So 14,000 Coloradans live with HIV today. That's 14,000 people with compromised immune systems who have an increased vulnerability to viruses like COVID-19. Both HIV and COVID-19 disproportionately impact communities of color, which is why this bill is critical to expanding access to preventative medications for those who need it most. So I think, especially given what we've seen with the pandemic over the past year, it's a really good framework to pose why pharmacists need to be engaged in this work. And when it comes to prevention, it's a really easy way for folks to access the services that they might not otherwise be able to access. So implementation in Colorado, there's a board-approved training program that was released last year. So as of right now, pharmacists are able to opt into this program. It's not every single pharmacist is immediately going to be doing this, but rather they can opt into the program to where there's a training module that they go through that allows them to start this dissemination process. And the current focus is around spreading awareness to pharmacists around this enrollment through the State Board of Pharmacy and various pharmacist associations. So they're just in the implementation phase. I think it's been a pretty slow rollout because there's a lot of moving parts when it comes to this. Next, there was a bill that was introduced in Oregon, House Bill 4116, introduced last year. There were some public hearing concerns around this, specifically around PrEP, because the bill text was so vague and around the broad scope of practice and around the removing of pre-authorization requirements. So this bill was not successful and died in the 2020 legislative session. But I think there is still talk that they're planning to kind of revamp what they did last year and introduce this again this year. Now, most recently, really exciting in Virginia, House Bill 2079, which was a broad pharmacist initiation treatment, similar to what we've seen here in North Carolina with the two bills that have been introduced in the House and the Senate. It was kind of a encompassing bill that allowed for 9 different groups of drugs and devices to be disseminated by pharmacists, and both PrEP and PEP were included in that set. The bill was introduced in January of 2021, and it passed in February of 2021. So it's really exciting. This was the first semi-southern state to pass this kind of legislation. And then Kentucky was able to pass a similar thing through the rules process. So theirs was not a legislative process, not a bill that needed to be introduced, but it was through the Board of Pharmacy and the Rules Change Committee. So really exciting stuff happening in the South. So I wanted to kind of highlight really quickly here in North Carolina where it comes to current PrEP providers. So as you can see, North Carolina kind of has the two big corridors of the I-85, I-40 corridor and the I-95 corridor. So if you look on the 40-85 corridor, we're doing pretty well, especially in more of the metropolitan areas like Raleigh, Greensboro, Winston-Salem, and Charlotte. But when you start looking at the more rural parts, particularly in the West and in the East, there are really, really large areas where there are no PrEP providers within any foreseeable distance. So folks would have to drive extended amounts of time to find a PrEP provider. And it's just really hard for them to find anything and access this prevention treatment. And then when you look at active PrEP use, it's not a surprise that it actively looks exactly like this. So the folks who are able to access it are the ones who are accessing it. So I think some key takeaways when we've looked at these policy changes is around knowing the local context and the supporters and the opposers that are going to be at the table when it comes to making these legislative or rules changes, the timing and the framing and acknowledging of the current context. So especially I think in our fight in the most recent year with the pandemic, I think highlighting the importance of pharmacists to take off the burden of health systems, and developing a plan for implementation, so protocols through the State Board of Pharmacy. So with that, I know that was a very quick overview, but did want to give folks a second. If anybody has any questions around that, feel free to drop them in the chat. So I think exciting things are happening across the country. And exciting things, I would say, here in North Carolina, there's definitely some things that we're concerned about and some areas of growth and modification that we can work for through advocacy, but definitely exciting things. And who knows, maybe this year we can get some things passed in the House or the Senate. And Elizabeth asked, yes, the slides, I'll send out slides attached as a follow-up with a couple of links as well.
Hey, Matt, it's Siobhan.
Hey, Siobhan.
How are you?
Good.
I know that it seems like it's early in the implementation stages in a lot of other states, but maybe California is the furthest along. Is there any sense of what the actual uptake is among pharmacists? You know, how many actually choose to go through the additional training, if that is a requirement in California, and how many actually do end up prescribing or administering PrEP and PEP?
Yeah, so I think that Craig is going to cover that in his portion in just a minute.
Okay, cool.
As far as kind of what it looks like in California, since they have been the longest running. So yeah, I think there's probably still a lot more to learn from that, and hopefully we'll have more information around what Colorado's implementation process looks like, and then I guess Virginia will follow after that. But yeah, hopefully that'll be coming. Awesome. Well, if there are no more questions, I'm going to go ahead and pass it to Craig to talk about California and what has been happening there. So Craig, the floor is yours.
Great, thank you. I'm going to share my slides here. There we go. All right, yeah, good to see everyone this morning. Hello from the West Coast. Happy to be here, and thanks for the presentations before. It was great, Matt, to see kind of what's been happening in all of the other states. I haven't been keeping track on what's been happening in all the states, so that was extremely helpful. So I'm going to talk about our bill SB 159 here in California, which of course included provisions around pharmacist delivered PrEP and PEP. Before I get into that, just want to talk a little bit about APLA Health for those who are not familiar. We are one of the oldest and largest HIV service providers here in LA County. And a few years ago, we became a federally qualified health center. So we now have several full-time clinics across LA County, which serve everyone, but have a specific focus on serving the LGBTQ community. We have about 10,000 patients that access primary care, dental and behavioral health services, the majority LGBT from communities of color, and the majority low income as well. And so background on PrEP uptake California, I think the picture here is similar to what's happening in many places across the country. There has certainly been, I think, exponential increase in PrEP use since it was first approved, but it is certainly well below where we would like it to be or where we think it should be. So some of the most recent estimates I've seen that there are currently about 20,000 people using PrEP in California. This is probably a bit of an underestimate, but it's one of the best figures that we have now. And that's really only about a fifth of those who could potentially benefit. So certainly a lot of people who could benefit from PrEP, even in a state like California that has really tried hard to expand access and make PrEP free for those who need it. Uptake is still extremely low. And of course, seeing significant disparities similar to those seen in other states and across the country. So uptake is lowest among Black and Latinx folks, especially young Black and Latinx gay men, among women, particularly Black women and youth. And of course, these are also the communities with the highest HIV incidence. So really thinking about, I like to think of pharmacist delivered PrEP as, one piece of the puzzle. And, this is certainly not going to suddenly result in, a rapid increase in uptake of PrEP and PEP, but I think it's an important piece of the puzzle in terms of expanding uptake. And so I think it's important to think about this bill in the context of other steps that we're taking to either make PrEP more affordable, to educate patients, to educate providers. I think all of those things are needed, but also, expanding the places where people can access these medications is another important piece. I think folks have already covered some of the benefits of pharmacist-delivered PrEP and PEP. Some folks may have a better relationship with a pharmacist. They may feel more comfortable accessing PrEP and PEP at a pharmacist. I think one of the key pieces for me is just the easier access, especially for PEP in California. Like most places, if you want PEP at nights or on weekends, you have to go to an emergency department or find somewhere that has longer hours. So it can be extremely difficult to access PEP in the 72-hour time frame. And so pharmacists really present this ideal opportunity that if there was widespread adoption of pharmacist-delivered PEP, then potentially someone could easily go to a pharmacist to access this medication in a timely manner. And of course, pharmacists are medication experts and really have a lot of experience providing adherence support and helping folks to stay on their medications, which we know is a really key piece with PrEP and something that has been challenging in terms of making sure that once folks get started on PrEP, that they actually stay on PrEP, for whatever length of time is needed. So now we'll get into our legislation, Senate Bill 159. This bill was authored by Senator Wiener. He's one of our senators in San Francisco and just a real champion for HIV and especially for PrEP. Folks may have seen some news stories about him. He came out as a PrEP user pretty early on, and so it definitely made headlines when he made that public. And so he's been a real champion for PrEP in California and in the legislature. So like it was mentioned, the bill was modeled after PrEP and PEP programs in other states. So pharmacies have certainly been providing PrEP and PEP under collaborative practice agreements in other states. And so while New York was certainly the first to expand the 7-day starter packs, we know that pharmacists in Seattle and other states have been doing this for quite some time, including in California. There had been pharmacies in California who had been providing PrEP under a collaborative practice agreement. And so, this wasn't completely starting from scratch. We had, evidence that pharmacists are qualified and trained to provide PrEP and PEP. It's just a question of, what is the mechanism and kind of how easy is it for them to be able to provide this service. So SB 159 had two key components, and I'll cover those kind of generally here and then go into them in greater detail. So the first component, of course, was related to PrEP and PEP. So it authorizes pharmacists to furnish PEP, the complete 28-day course, and then limited quantities of PrEP, which I'll talk about in a minute without a doctor's prescription. It also made furnishing PrEP and PEP a covered benefit under Medicaid so that pharmacies could seek reimbursement. And then the second component is that it prohibits prior authorization and step therapy for PrEP and PEP generally. I won't talk about this piece too much because I know we're focused on pharmacist-delivered PrEP, but I will just note that this was a really key piece of the bill. This was something that we had been hearing about for years in California, and the way that prior authorization requirements in particular, delayed access to PrEP, made it much more difficult for people to access the medication because our frontline staff were spending so much time dealing with this paperwork with insurance companies that it was making it more difficult for folks to access the medication. So generally, the legislation prohibits prior authorization and step therapy. This only applies to state-regulated health plans. So some health plans continue to be exempt from state law. And there was an exception here. And so prior authorization and step therapy is permitted if there is an FDA-approved therapeutically equivalent medication. So what that means in practice is that with the introduction of generic Truvada, the prior authorization and step therapy is permitted for the brand version of the medication. But because there is currently no therapeutically equivalent version of Descovy, prior authorization and step therapy are prohibited for Descovy in California. And I should just note on this pharmacy piece, I know it was mentioned in the context of the law in California, this is being introduced in conjunction with a number of other medications. And that was the law prior to SB 159 in California. So pharmacists were able to provide naloxone, contraception, immunizations, a number of other medications. And so this was just adding PrEP and PEP onto the services that they could already provide. So I'll go into PEP first and then talk about PrEP. So PEP was a little bit easier. We really did not face a ton of opposition. Most of the opposition came around PrEP. I think, it just makes a lot of sense as to why pharmacists are an ideal location for people to access this medication, especially something that is, so time sensitive. Pharmacists are just the ideal place to do this. And so we really didn't face a lot of opposition from the medical establishment in terms of allowing pharmacists to deliver PEP. And so pharmacists who complete a training course that has been approved by our state board of pharmacy can provide the full 28-day medication regimen for PEP. And there is no limit to the number of times. And so there was some pushback in the beginning about folks wanting to, perhaps say that pharmacists could only provide PEP, once every year or once every 2 years. And there was the concern that patients would, go from pharmacy to pharmacy and potentially access PEP, an exorbitant number of times in a year. And I think just from the patient advocate perspective, one, it just does not make sense to place limits on patients in terms of a, really important medication like this. But two, I just don't think these concerns play out for the vast majority of people. I think very few, if any, people are going to be, hopping from pharmacy to pharmacy so that they can, be on PEP every month in the year. So this was one piece that was important, that we wanted to make sure that this was accessible for folks. These are the requirements included in the bill. I think something important to keep in mind about the legislation in California is that the legislation was very specific about the definition of PrEP and PEP and what needed to occur before they could be furnished by pharmacists. Other states, including Colorado, have taken a different approach where the legislation is less specific, but it directs the Board of Pharmacy to create drug therapy protocols that dictate kind of how the medication should be dispensed. And so I think there are kind of, positives and negatives to both of those approaches. But I know from working with our California Pharmacists Association, I think one of their main concerns about requiring the Board of Pharmacy to develop drug therapy protocols is one that, it could take a long time. And so, waiting for the Board of Pharmacy to develop those protocols could take several years. And then it really gave us kind of less control in terms of, what might be appropriate in terms of what needed to occur before PrEP and PEP could be dispensed. And so we worked closely with the Pharmacists Association and with other medical provider groups to kind of hash out what we thought were the key elements that needed to be included here. So for PEP, these are all of the elements, just making sure that the exposure occurred within 72 hours and meets the CDC guidelines. The pharmacist can provide an HIV test, but I think it's important to note here that an HIV test is not required. So, an HIV test is certainly recommended but not required for PEP because it is a complete medication regimen for HIV. And so I think this is an important piece, that if a patient was trying to access PEP but wasn't willing or able to receive an HIV test, they could still access the medication. And then just, of course, providing counseling, making sure the patient knows about PrEP, and then notifying the patient's primary care provider if they have one, or if they don't, letting them know where they could go for follow-up care. So next, getting into PrEP, and this is certainly where we encounter the most opposition from the medical establishment, and I guess I say the medical establishment is primarily the California Medical Association, but there were other groups who were opposed as well. So when the bill was first introduced, it did allow pharmacists to dispense PrEP on an ongoing basis, and included language around kind of the necessary labs for PrEP. And like I said, there was really intense opposition, and I think a lot of concerns from kind of the provider community about the importance of patients seeing a primary care physician to monitor labs on an ongoing basis for PrEP. And so ultimately, we decided to amend the bill because of that opposition. And I believe in the end, the California Medical Association ended up taking a neutral stance. And so they did not come out in support of the bill, but ultimately were not opposed at the end as well. So just, I know that this has been, I think a piece of discussion and debate in California about, how useful this piece is going to be, because it is very time limited. But we did have to make this concession because of the opposition that the bill faced. So the bill states that pharmacists who complete an approved training course can provide 30 to 60 days of PrEP without a doctor's prescription, and they can only provide one 60-day supply no more than once every 2 years. And so this concern about kind of pharmacy hopping definitely came up here, that if you didn't have a limit, patients could potentially just go from pharmacy to pharmacy and never actually see a doctor for any kind of follow-up labs related to PrEP. And so this piece is certainly very limited in California. I think the way that I like to think about this is either, PrEP initiation, so a way for someone to go to a pharmacist and get initiated on PrEP and then connect to a primary care physician, or potentially kind of a stopgap. And so if someone moved to a new area and did not yet have a primary care physician, or for some reason, ran out of medication, that they would be able to go to a pharmacy and access a limited quantity. But certainly, this is much more limited than we had originally intended. And I would just note Senator Wiener, who authored the bill, I think recognizes this, and I think all of us are kind of committed to monitoring implementation and just seeing how it goes, and perhaps coming back to this in a few years if we need to make changes. These are the requirements in the bill in terms of what needs to happen before someone can receive PrEP. They are very similar to PEP, except an important piece is that a documented HIV negative test is required. This is more important for PrEP than it is for PEP. And so this has to be a documented negative HIV test from the previous 7 days. So this can either be something that the patient receives an HIV test and then presents to the pharmacist, or a pharmacist could deliver an HIV test on site. Making sure that the patient doesn't have any signs or symptoms of acute HIV infection or taking any contraindicated drugs, and then the same requirements that were there for PEP as well. So I'll just briefly talk about implementation, and then happy to answer any questions that folks have. So the legislation was passed in 2019. The trainings became available last year. And so pharmacists have begun completing the training in California. The State Board of Pharmacy just launched a registry where pharmacists can essentially, put their information in there so that you can search and find if there's a pharmacist in your area that offers PrEP and PEP. To be fully transparent, I have not been told by the Board of Pharmacy exactly how many people have taken the training. So I don't know what the exact number is in terms of how many folks have completed the training, but in my conversation with folks from the California Pharmacists Association, I think the number is pretty low. And I think there are a number of reasons for that. I think COVID is the number one reason that, this has really taken everyone's full attention. And so, adding PrEP and PEP onto your, pharmacy practice has not been top of mind over the past year. I think, some of the other implementation challenges kind of looking ahead just continue to be patient and pharmacist awareness. And so, like someone asked previously, this bill is only effective to the extent that pharmacists take the training and offer PrEP and PEP. And, there is certainly no guarantee that pharmacists on a wide scale basis are going to opt in to providing this service. And then patient awareness is huge. There's, this is only going to be effective if patients know that this service is available and if they know where these medications are accessible. And so, I think thinking about implementation, this is something that does not happen overnight, and that this really takes, a concerted effort on the part of a lot of different stakeholders to make a bill like this effective. And so, passing the legislation is almost the easiest piece, and actually getting it to work for folks on the ground is a completely different game. So, the patient education, there was not any funding included in the bill for patient education. And so kind of looking ahead, information about pharmacist delivered PrEP is going to need to be incorporated into our existing education campaigns and making sure that folks have this information. But first, making sure that pharmacists are actually offering this service is going to be key. Competing priorities, of course, I think, that's self-explanatory. Like I mentioned with COVID, pharmacists have a lot of different things that they're asked to do. There was a really excellent article in the New York Times recently just talking about the various burdens that are placed on pharmacists already. And so many may not have the capacity to offer PrEP and PEP and, provide the HIV testing or the counseling that's needed. The environment is a question. Some pharmacies might have spacing and privacy for counseling and others don't. And so, of course, this is a sensitive service. And so someone coming in to potentially a pharmacy that has lots of people around and feeling comfortable and safe to ask about accessing an HIV prevention medication potentially, definitely presents a challenge. And so something that we have to consider as these programs are rolling out. And then billing, of course, and reimbursements. Pharmacists, as good of people as they might be, also need to have some kind of financial incentive to offer this service. And so, being able to be reimbursed for not only the medication, but also for the counseling and the HIV testing. And so, we were able to get reimbursement for the Medicaid program, but there's currently no reimbursement for most folks who are privately insured. And so, what is the financial incentive and kind of how are pharmacists being reimbursed for these services? The last slide here is just something that we're working on in California, is we do have a PrEP assistance program that covers the costs associated with PrEP for both insured and uninsured folks. We've been working with our state Department of Public Health on a temporary coverage program so that, this would help to cover the cost for PrEP and PEP at pharmacies. And so folks who did not have another payer source would be able to access the either 60-day supply of PrEP or the complete course of PEP. And then this PrEP app temporary coverage program would also cover the HIV testing based on Medicare rates. And so hopefully that helps to address this one piece about billing. But of course, the number one focus right now is actually rolling out the training and making sure that pharmacists are opting in and beginning to offer this service. So I'll stop there and happy to answer any questions.
Awesome. Yeah, there have been a couple that have popped up in the chat, and I think you kind of covered this first one that I'm seeing. So what are your thoughts on pharmacists not being recognized federally as providers and thus not being able to bill for services?
Yeah, good question. I am not expert on that recognition federally. I would have to defer to kind of my pharmacist colleagues on that piece, but certainly the billing presents a challenge. And so, anything that we can do to increase the reimbursement and the financial incentives for pharmacists is going to be key for legislation like this.
Yeah, and I will flag that I think in Kentucky, we presented on this at the NMAC Biomedical Summit with a colleague in Kentucky who worked on their rules change. And she mentioned that in Kentucky this year in March, actually, they passed unanimously, it's called House Bill 48, the ANN Act, and it creates mechanisms for pharmacists to bill for services and procedures for reimbursement. So I think that's something to look into as far as ensuring that pharmacists are getting reimbursed for those services, because I think that's crucial and would really help in increasing knowledge and buy-in to the program.
Yeah.
Okay, another question from William. Are there any materials available on the trainings themselves the pharmacists are required to complete in California? Been struggling to find some.
Yes, so are you asking for a copy of the training or just information about how to access the training?
And William, you're welcome to come off mute if you would like to.
Sure, more so the latter. I'm actually trying to put together a policy brief related to this, and I just wanted to access some of the materials for the trainings.
Yeah, I'm happy to get that information and send it to Matt as soon as I get it.
Great. Next question. Do you have good pharmacy examples that are demonstrating these services?
Yeah, so I mean, as far as folks who are offering PrEP and PEP under SB 159, most of the folks who I've talked to are still in the implementation stage, and so still kind of developing protocols and then figuring out how to incorporate PrEP and PEP into their pharmacies. We do have pharmacies that were providing PrEP and PEP before SB 159, and I think one of the best examples we have here in California is Mission Wellness Pharmacy in San Francisco, and they had been providing PrEP and PEP under a collaborative practice agreement for a long time. I know I believe it's the Shelley Ross Pharmacy in Seattle, I think, has been held up as a model in pharmacist delivered PrEP and PEP as well. So I think those are a couple to look to, but I don't yet have a really good example of someone who's offering PrEP and PEP under SB 159 yet.
Okay, great. Yeah, and Kelly Ross was actually mentioned in the chat right after that question.
Okay.
Alejandro asked, what did the opposition look like and how intense was it?
Yeah, I mean, the opposition was most significant, certainly around pharmacist delivered PrEP. That came primarily from the California Medical Association and their allies. AIDS Healthcare Foundation in California was also opposed to pharmacist delivered PrEP. And, I think the concerns were around making sure that patients were getting the necessary labs and that there was a primary care physician to monitor any other, issues that might come up while someone is taking PrEP. And so, I would just say, I think the opposition was pretty intense. The California Medical Association wields a lot of power in California. The chair of our Senate Health Committee is a doctor and certainly sympathetic to the concerns of the Medical Association as well. So it was extremely challenging navigating that piece, and that's certainly why we had to limit the bill. And so, the PrEP piece is only 60 days once every 2 years, and that's definitely because of the opposition that we face.
Yeah, and I'll flag that here in North Carolina, as we've kind of been working on this process, I think that was something we were concerned with. And initially, when we were working with the folks at NCAP, I think the initial bill language did not include PrEP. It was just PEP, because there was a lot of pushback from our medical society as well. And somehow that it managed to get into the bill, which was beyond us, because there was very vocal of opposition to it. So we're interested to know how that happened and how the language shifted so much. But yeah, and kind of along that topic, I have a question around what did the advocacy look like as far as like ensuring that there was enough education around this and getting buy-in from the legislature?
Yeah, it's actually a really great question. It's been interesting here in California. You know, PrEP was first approved in 2012. We had our first PrEP bill in California was in 2014 around, you know, making sure that folks who are receiving an HIV test are receiving information about PrEP and PEP. And so there has been kind of, you know, gradual education within the legislature about PrEP. And I think growing awareness of the importance of these medications. And so I think when we, you know, were coming into this bill in 2019, this was certainly not the first time that folks were hearing about PrEP and PEP. And I think we had done a pretty good job of kind of laying the groundwork as to why these medications were so critical in our efforts to address HIV. And I was pretty, you know, there were moments in some of our committee hearings when I was pretty shocked to hear, you know, just kind of the, you know, full-throated support for the bill on behalf of some of our members of the legislature, and folks just saying, you know, these medications are really critical. And, you know, even with some of the concerns from the medical community, you know, we need to do everything in our power to make sure that they're accessible. And so, you know, I think this bill and just kind of efforts broadly to expand access to PrEP have really resonated in our state capital. And yeah, so I think that's just kind of a testament to the work of all the advocates here in California, and, you know, just really building that support in the legislature. Because you know, even some folks who had not typically been strong allies, you know, were really vocal in their support of this bill.
Yeah, and shameless plug, our advocacy day is May 4th, and I'll be dropping that in the chat later. But I mean, that's definitely an area where you can meet with legislators and really talk about how important this stuff is. So, I mean, I think that's huge, is being sure that gaining buy-in through education is immensely important. All right, any other questions in the chat? It looks like things have slowed down. Awesome. Well, thank you so much for joining us this morning, Craig. I know it's an early morning for you in California with the time change, but we really appreciate you providing this information for us. Yeah, thanks for inviting me. It was great to meet with y'all. Awesome. So a couple things that I wanted to wrap up with. So as I mentioned, our advocacy day is on May the 4th. I'm going to drop the link to the registration page into the chat. I'll also send this out via the follow-up email with our materials and whatnot. If you register by the 20th, you will get a fun swag bag. So be sure to do that because everybody wants a swag bag. But that's going to be May the 4th, and we'll be meeting with virtually representatives from across the state, specifically your representative. We'll be sure to reach out to them if you register and to talk about important issues. And I think there's several different things that we're going to be flagging for them. This pharmacist piece probably being one of them, and then another few bills. I did want to draw attention to a couple of things that are a little bit problematic that are happening in our House and Senate that I definitely wanted to flag. So I think the most pressing thing currently, or there's four pressing bills that have been introduced for us. So the first three are three anti-trans bills that are really harmful. The first being House Bill 358, the Save Women's Sports Act, which would not allow for trans folks to participate in sports that align with their gender identity, which we all know is problematic. Senate Bill 515, the Healthcare Heroes Conscience Protection Act, which would allow for healthcare providers to opt out of treatment for folks if it goes against their moral or religious beliefs, which again, baffling. And Senate Bill 514, which is the Youth Health Protection Act, which would not allow for trans folks specifically under the age of 18, access to gender affirming care. So really scary stuff for our trans community here in North Carolina. And there's a lot of advocacy that needs to happen to make sure that these bills are struck down. So please contact your House reps and senators around these. Also wanted to draw attention to Senate Bill 607, which was introduced, I think, last week. It's called the Substance Use Disorder Safety Act. It's a really problematic bill that limits the power of syringe programs and would be really detrimental to the fight against opioid overdose and syringe exchange programs here in North Carolina. So that's Senate Bill 607. Look into that as well. It's really, really damaging for the vital work that syringe programs do here in North Carolina. So definitely wanted to flag those, and I'm sure we'll be talking about those more, specifically around the syringe access programs. We'll be doing a webinar on the 29th of April, so not next Thursday, but the next. So make sure to keep an eye out for that, and we'll send around that link as well to take a deeper dive into this policy topic. But other than that, I think that we are almost at 11 o'clock. So unless anybody has any follow-up questions, chime in now. But please register for HIV Speaks on Jones Street. Thank y'all again so much for joining us this morning. Feel free to reach out to me if you have any questions, and we'll be sending out a follow-up email with the recording, the various slides that were used, and any resources that we have. So unless y'all have any questions, feel free to skedaddle and have a great rest of your Thursday.